Hi, welcome to the Infection Control Review from the Maryland State Dental Association Foundation. My name is India Chance, and I'm a certified infection control educator. If you're watching this, then that means you've agreed to volunteer for one of our dental missions. First, we'd like to say thank you. And next, we'd like to share a few reminders on how you can stay compliant with infection control guidelines during your event. The first area we will discuss is personal protective equipment. The CDC states that personal protective equipment is the wearable equipment that is designed to protect dental health care providers from exposure to or contact with infectious agents. Now, when we are speaking about PPE, we can't forget about hand hygiene. This is the first task that must be completed prior to putting on any PPE. Let's take a look at a video from the American Dental Association that reviews proper hand hygiene.
For healthcare professionals, including dental personnel, effective hand hygiene is critical for reducing the risk of transmitting organisms. Clean hands protect you and your patients. Hand hygiene is a general term that applies to routine hand washing with water and plain soap and water. Hand washing with water and an antimicrobial soap, cleaning hands with an antiseptic alcohol-based hand rub, and surgical antisepsis, using water and an antimicrobial soap or water and non-antimicrobial soap, followed by an alcohol-based surgical hand scrub product with persistent activity. In keeping with infection control procedures in the dental practice, avoid wearing jewelry, including watches. Keep your fingernail tips trimmed to about 1/4 inch. They should be neatly filed with no sharp edges. So when should hand hygiene be performed? The U.S. Centers for Disease Control and Prevention, or CDC, recommends that hand hygiene be performed before and after treating each patient. In other words, before putting on gloves and after glove removal, as well as following ungloved hand contact with a patient's intact skin. Before leaving the dental operatory, after touching contaminated objects, when hands are visibly soiled, after removing gloves that are torn, cut, or punctured during a procedure, and before you replace damaged gloves. When handling contaminated instruments for instrument processing, always wear utility gloves. Never use bare hands. What products can be used? For routine non-surgical procedures, hand hygiene can be performed with plain soap and water, an antimicrobial soap and water, or an alcohol-based hand rub that has an alcohol concentration of 60 to 90%. If your hands are visibly soiled, they must be washed with soap and water. First, wet your hands and apply a small amount of liquid soap onto one palm. Rub vigorously until lather appears and continue rubbing for at least 15 seconds. Scrub between your fingers, under your fingernails, and the back of your hands, as well as the palms up to your wrists. Then, rinse your hands under running water. Dry your hands completely with a disposable towel. If the faucet doesn't have a foot pedal or automatic shutoff, use the towel as a barrier to turn off the faucet. To clean your hands with an alcohol-based hand rub, check the manufacturer's instructions for how much of the product you should apply. Some manufacturers simply state to wet hands thoroughly with the product. Dispense the alcohol-based hand rub on the palm and rub your hands together, covering all surfaces and fingers until your hands are dry. If your hands feel dry after rubbing them together for 10 to 15 seconds, you most likely have not applied enough product. Is soap and water better than an alcohol-based hand rub? According to the CDC's recommendations for infection control in dental settings, either product can be used for routine hand hygiene, provided that there is no visible contamination on the hands. Alcohol-based hand rubs that have an alcohol concentration between 60 and 95% are more effective at killing germs than those with a lower alcohol concentration or non-alcohol-based hand sanitizers. Also, while alcohol-based hand rubs can inactivate many types of microbes, they must be used correctly to be effective. Alcohol-based hand rubs are useful when hand washing facilities are not available or feasible. For example, when you are working in a mobile clinic, doing routine dental screenings in a school, when there is a boil water advisory from your water supplier, and when hands are not visibly soiled. Alcohol hand rubs are also helpful for reducing skin dryness and irritation. Regardless of which hand hygiene product you use, Hands should be completely free of moisture before you put on your gloves. Dry hands help reduce skin irritation. Good hand hygiene practices combined with wearing gloves are essential elements of infection control. And effective hand hygiene protects you and your patients. For more information about the ADA Professional Product Review, visit www.ada.org/PPR.
What a great reminder about such an important task. Now let's take a look at a video from the CDC reviewing how to don or properly put on PPE.
There are multiple sequences recommended for donning or putting on and doffing or taking off PPE. One suggested sequence for dental healthcare personnel, or DHCP, includes the following steps. Before entering a patient room or care area, perform hand hygiene. Next, put on a clean gown or protective clothing that covers personal clothing and skin. For example, forearms, that is likely to be soiled with blood, saliva, or other potentially infectious materials. Note that gowns and protective clothing should be changed if they become soiled during use. The next step is to put on face protection. If you are using a surgical mask, the mask tie should be secured on the crown of the head with the top tie, and at the base of the neck with the bottom tie. If the mask has loops, hook them appropriately around your ears. If you are using a respirator, the strap should be placed on the crown of the head with the top strap and the base of the neck with the bottom strap. Perform a user seal check each time you put on a respirator. Next, put on eye protection. Protective eyewear that have gaps between glasses and the face, for instance, safety glasses or trauma glasses, likely do not protect eyes from all splashes and sprays. Personal eyeglasses and contact lenses are not considered adequate eye protection. Now put on clean, non-sterile gloves. Gloves should be changed if they become torn or heavily contaminated. Now you can enter the patient room.
Great information, right? Now let's take a look at a video from the CDC discussing how to properly remove contaminated PPE.
After the completion of dental treatment, you may now doff your personal protective equipment using the following steps. First, remove gloves. Then, remove gown or protective clothing and place it in a dedicated container for waste or soiled linen. Discard disposable gowns after each use, or launder cloth gowns or protective clothing after each use. Then exit the patient room or care area. Perform hand hygiene. Then remove eye protection by grabbing the strap and pulling upward and away from head. Do not touch the front of the eye protection. Discard disposable eye protection after use. If you are using reusable eye protection, clean and disinfect it according to manufacturer's reprocessing instructions after each use. Next, remove and discard your face protection, such as your surgical mask or respirator. It is important that you do not touch the front of the respirator or mask. For a surgical mask, carefully untie the mask or unhook from the ears and pull it away from the face without touching the front. Then discard in a waste container. If you have used a respirator, remove the bottom strap by touching only the strap and bring it carefully over the head. Grasp the top strap and bring it carefully over the head, and then pull the respirator away from the face without touching the front of the respirator. Finally, perform hand hygiene.
I really appreciate those videos. It gives me a great visual on how to perform proper hand hygiene and what PPE I need to wear during patient care. Hopefully you got some great information as well. Now let's talk about our next focus area, which is environmental infection prevention. This is where I will show you how to remove contaminated items and disinfect reusable dental equipment. Let's take a look at this next video. Now let's review our last focus area, which is sharp safety. The CDC states that sharps injuries are a serious problem in healthcare settings. They estimate that there are over 385,000 injuries that happen in healthcare every year. These injuries significantly increase a healthcare provider's risk of exposure to bloodborne pathogens. To reduce needle stick injuries, the CDC recommends that after delivering anesthesia, the needle is recapped with a device that prevents the dental healthcare provider from using two hands to recap the needle. Dental healthcare providers are also allowed to use the one-hand scoop method. Take a look at this next video demonstrating 2 ways to properly recap a needle. If performed properly, recapping a contaminated needle can be done very safely. Well, I think that about wraps it up. Again, on behalf of the Maryland State Dental Association Foundation, we want to say thank you for volunteering your time and helping us to further our mission, which is to improve the oral health of Marylanders through support of programs that improve access to dental care. I hope you have a great event.